That website is called www.myuhc.com. And really, myuhc.com is really designed to be your portal into all things UHC. So whether it be searching our network, searching your prescription drug list, reviewing any claims, or getting information on some of the different, embedded health and wellness programs that you have access to. This is really the one-stop shop that you're going to have to, that you can visit if you ever do have any questions. And on top of the desktop version of the website we're going to be going through today, we also have a companion app, and that's called the United Healthcare mobile app. That's essentially myuhc.com on your mobile phone or your tablet. So I will make the distinction now. The mobile version of myuhc.com is going to be more tailored towards kind of on-the-go items. So you're still going to be able to look through our network, do some pretty high-level cost estimates, review your claims. But if you do want any detailed information on like programs and services and resources, I would definitely recommend coming to the desktop version of myuhc.com. And before we actually dive into the website, I just want to really quickly give your entire group a really big pat on the back. I pulled a registration report to see just what percentage of your group has been registered, and you guys have just about 70% of employees registered on the website, which is fantastic considering you've been such a new client of ours. I will kind of pat you all on the back here. Typically, I see people like in the 50% range. The first year, you guys have blown that out of the water. So for the groups of you that have already been signed up on the website, really do appreciate it. But for those who haven't signed up yet, it's never too late. You can register at any time through myuhc.com. And the only thing that you're going to need when you go out and register on here is your member ID card. When you hit the landing page, this is what you're going to see on myuhc.com. If you are a new member, you're going to go to this link to the left-hand side and click the register button. And when you're registering for a new member, just like creating an account for Amazon or your online shopping, it's going to ask you for your first, last name, your date of birth, and then it's going to ask for a couple different numbers from your member ID card. The first thing is going to be the member ID. This is typically going to be like a pretty long number, about 9-ish digits. It's going to be on the front of your ID card. And then the next thing it's going to ask for is your group number, which is going to be a 6-digit number. And for you all specifically, that group number is 919927. And again, it will be listed on your member ID cards. And that's how you're going to basically go and get your account created through the website. We're going to take your name, your date of birth, your member ID, and your group number, and look behind the scenes to link your eligibility up to your specific plan information and drop you into the website. But I'm sure you're probably thinking right now, okay, Logan, what if I don't have my ID card? What if I've thrown my ID card away? What if my cell phone's broken and I don't have access to my app? Or what if, I just don't know where my ID card is? Well, no need to fear. You do also have the option to register with your social security number. When you click this button here, it is going to update the below here to ask for the last 6 digits of your social security number. So with your first, last, date of birth, and the last 6 of your social security number, that is how you're going to go and create your account. And once you've got this information, it's going to look behind the scenes, see if you're eligible, and then it's going to ask for you to create what we call our Health Safe ID. And the Health Safe ID is just, think of it just like your username and your password to United Healthcare. But one really thing special that is about the Health Safe ID is that in previous years, if you were a UHC member, you might have a username for our desktop version of myuhc.com, and then you might have a separate username for our mobile app. You might have a separate username for any of our Optim apps, our companion apps. But we have sprung into the 21st century, as I like to say, by rolling out our Health Safe ID, which is essentially going to be your one and only username for anything UHC related. So if you create your Health Safe ID through myuhc.com, that's going to be the same login that you use on the mobile app. So you're only going to have to be remembering one username and one password, no matter how you're accessing your UHC benefits, which I think is really cool. So once we verify your account, like I said, we're going to ask you to create a username, create a password. We are going to ask for your email address as well, so we can link that up with your account. Pretty straightforward here. We will ask you to put in a phone number for a confirmation code. I know I typically see this a lot if you're using computers that have some kind of private browsing in play. We do use two-factor authentication on our website. So if you do log in after you've created an account, sometimes it can ask you to confirm your identity by texting a confirmation code to your cell phone to basically get your account created. But follow all these prompts. Your account's going to get completed, and you're going to use that username and password to log into the website. And now what we're going to do is we're going to transition over to the member portion of our website, which is the landing page. So once you get your account created, you're going to come in through this orange button here, the sign in button. It's essentially going to ask you for your health safe ID and that health safe ID password. You're going to input that here, click sign in. Oh my goodness me. I do apologize here. The demo here seems to be acting up. There we go. So you're going to come in here, put your user ID, your password, you're going to hit sign in, and then it's going to drop you in to this view here. Now I will preface this by saying this is just a demo tool. It has a lot of different features and functionalities. While everything that you're going to be seeing here may not necessarily be showing on your specific account, the things I'm going to be talking through here are going to be applicable to your accounts. You may just see them in a different place, or it may look a little different on your end. But regardless, whatever health safe ID you use, once you actually register and log in, this is the landing page you're going to see. And one thing I will say right off of the bat, when we designed this website, we designed it to hopefully get any kind of questions that you may have, or really get your tasks done in the fewest number of clicks possible. And what do I mean by that as well? While we do give you a navigation tab at the top here, which is where you're going to be going to the different sections of the website, again, depending on your needs. So if you need to find a provider, we're going to come here. If you need to view your claims here, if you need to want to verify coverage here. While these are great resources if you had in-depth questions, one thing I really like about our website is that when you just log into the website, this is the dashboard that you're going to see, your home screen. And as you scroll down, you're really going to get little tidbits of essentially the entire website just on this landing page here. So if you had a really quick question about, I wonder what recent claims have came through, you can actually just log into myuhc.com and scroll down. We're going to give you a high-level summary of some of the most recent claims that have come through. We're going to give you just some pop-up messaging about potential programs or services, resources you can take advantage of. We are going to give you additional links here around different health resources, virtual visits, embedded health and wellness programs, behavioral health items. We're going to give you additional quick links to different areas of the website, like managing your claims, managing your prescriptions. As we keep scrolling down, again, we haven't even clicked our mouse yet. It's good. We're going to get a good listing of some of those common services and the benefits that are tied to them. And again, one really great thing about our website, these are tailored to you and your family and the specific plan that you're on. So if you need to just verify, hey, what's a primary care visit, you can come scroll down here, get that information. We're also going to give you a high-level summary of your medical accounts. So how much you've met towards your deductible, both you individually, as well as your family deductible and your out-of-pocket maximum. We're also going to break out what your total billed charges have been throughout the entire plan year listed below. So again, a lot of information at a high level on our landing page. And then these individual tabs that we're going to go through up here is essentially just digging deeper into a specific area of the website, which is what I really like. Now, before we actually dig in to the different tools we're going to be going through, probably the most important section of this website is going to be in the top right-hand corner, right next to your little view recommendations. That's your view and print member ID cards button. Now, like I said, things happen. We lose our ID cards. We need to get copies of them. We need to verify things. This is the button that you're going to use to view all the member ID cards that you have through UHC. And if you do need to print a copy or request another copy be mailed to you, this is the section you're gonna come for that. So with these ID cards, you're gonna be able to view the front. You can also view the back. If you do need to get an ID card mailed, we're gonna give you a link for that, and you can print it here. Now, you can view member ID cards on the desktop version, and you can also view your ID cards through the mobile app as well. So if you ever do find yourself in a provider's office and you can't find your ID card, pull out your smartphone, go to your United Healthcare mobile app, and you can actually send a copy of your ID card from your mobile phone to your provider, or you can show your card to like the pharmacist, for example. I've even had individuals who I've worked with try to scan the card from their phone, like sticking it on the little scanning machine. Didn't work very well, but you know they've done that. So there's a lot of different ways that you have to get a copy of your ID card if for some reason you do not have one available, or you may have lost it. Now we're going to talk about some of the different tools and resources you're going to have access to. And the first tool is going to be located here in this Find Care and Costs tab. Now, the Find Care and Costs tab is going to be dedicated to mainly two things. One is going to be searching for physicians and facilities that are in our network, and also estimating costs of various services that you may have throughout the year. And when you're in this tab, this is what you're going to see. One thing I will note on the location section, we are already going to have your specific location included in your member website. So as you're using the search tool, keep in mind these providers are going to be based on, you know, whatever zip code you have in our system. That being said, you can change locations at any time by clicking on this, entering in a zip code, a city, a town, a state, and adjusting the tool as needed. But really, when you land here, think of this part of the website like a giant funnel. We're basically going through, making selections, and we're funneling down our results. Now, if you do know the provider that you want to go see, you just automatically know, hey, I know my provider's name is Dr. Joe Smith. You're more than welcome to type the provider's name up here, but if you are not sure what providers are in your area, or you just want to get a directory listing, you can come down to the below here and view our providers either by our medical directory or by our behavioral health substance use provider directory. So for the first example here, we're going to go ahead and use the medical directory. And again, we'll think about a funnel. Medical directory is a pretty broad category. When we click on that, we're going to see additional subcategories that you can select from. So things like physicians that are in our network, places like hospitals or clinics or labs, imaging centers. If you wanted to search by a specific treatment, like let's say you have you're going in for an MRI, you can search by treatments and it'll give you all the locations that can perform an MRI. Same thing with conditions. If you want to search by providers that maybe deal with a certain type of condition, you can do that. And then the last thing on here is cost estimate. I will save that for a little bit. But for this example, we're going to go in our provider directory and we're going to look for primary care physicians. Again, like a funnel, we do break out our directory, primary care specialty, medical groups, and then virtual visits. So our virtual visit network is Doctors on Demand, AML Teledoc. You're going to access this here. But for our example, we're going to go to primary care and we're going to look for primary care physicians. So again, think of it as a funnel. Every click, you're getting more and more specific. And once you get down to the results page, this is what's going to populate on your screen. And on top of just the results that you're getting, one thing I will have you take note of is just how it's displayed on your screen. So you'll notice we give you on the right-hand side is going to be the results segment. So all the physicians are going to be outlined here, their information. And then on the left-hand side is where we give you your filters. So ways that you can go about refining your results by location, patient reviews, specialty types. That's all going to be located on the left. And that's really important because when we talk about other areas of the website, we're going to use this exact same format with a lot of our search tools. So you really only have to learn how to use one specific search tool on our platform to apply that to a number of different areas in the website. But this is going to give you all those physicians that are in UHC's network. And remember, staying in network is going to give you the highest benefit under your plan. Now, as you're going through and looking through these physicians, you're going to see a bunch of blue hearts next to their names. Now, these blue hearts denote something that we call our premium designated program. And basically, as we're contracting with physicians across the state, we are essentially rating all of our physicians on two primary metrics: quality of care and overall cost efficiency of care. And for those individuals that have two blue hearts, they are meeting their specialty's national standards for quality of care and cost efficiency. So looking for those providers with two blue hearts, throughout the long run, you can typically see higher qualities of care at the lowest overall cost to you and your family. So like any other online directory, we're going to have all the provider names linked here. If you wanted more information, you can click on their name, and it's going to take you to this overview section here where it's going to give you information on their primary address, how to contact them, the website to their specific hospital. If the provider does practice at multiple locations, you can get this information here in the location screen. It's going to list out all the different locations that they practice under. If you want to look at patient reviews, we have that information, areas of expertise, and then probably one of the most important sections under all of our physicians here is going to be the services and costs tab. Now, we do try to give you as much information as possible when it comes to the different services they can perform to you. So you have an idea about what you're going to be spending out of pocket prior to having the visit done. So under each one of our physicians, we're going to give you the number of services they can provide for you, and then a couple numbers next to them. The first number is going to be an average cost of that particular service or particular procedure near your specific zip code or the zip code that you have provided in the tool. So for this example here, an office visit for an established patient who's high complexity, the average cost near this zip code is about $130 to $230. And then right next to that, we're going to show you what this physician's estimated cost is going to be for the service. So basically, what is this physician charging for this service? So you can, at a high level, see, okay, this physician right here is charging below the average cost in my area. And then we're also going to give you a little breakout here at a high level about what your plan would pay should you have this visit done, and then what your estimated out-of-pocket cost will be. Again, this is more of a 30,000-foot overview, but if you did want to see a full estimate, we do give you the ability to link over to those full estimates. And if you were to click on this, we're going to run through all of our claims on the back end, all of our different coding procedures, take that into consideration, and give you a screen that looks a lot like this. And this is basically what your cost estimates are going to look like. Again, at the very top here, we're going to give you the high-level overview. It says, hey, total cost, insurance going to pay X, you're going to be estimated this much out of pocket, but we're going to take it one step further and actually give you your specific care path directly down below. So I know for this specific example, it only has one step. You're just going in for an office visit. But let's say, hey, we're looking up a estimate for, let's say, a knee replacement. A knee replacement is going to typically involve, an office visit to meet your primary care physician, meet with your physician, get your information taken care of prior to the service. Then you're going to have a surgery at a facility with a surgeon performing the service. And then you may have, one or two or three follow-up visits. And for those more common, or for those more complex services, I must say, we're actually going to break out not only the high-level out-of-pocket cost up here, we're actually going to break down the actual steps to the service. So we're going to say, hey, the first office visit, you're going to be meeting with this physician. Here's what we're estimating your cost is going to be, and here's what's going to be out of pocket to you. And then we're going to say, okay, step 2, you're having your service done at this specific facility. Let's call it IU Health. IU Health is going to charge you this much for the service, and here's what you're going to pay out of pocket. And then you're going to have a follow-up visit with, the same doctor. He's going to charge you X amount for this follow-up visit, and you're going to be paying that out of pocket. So a really, really great way to dive in and actually start estimating your out-of-pocket costs for healthcare services, kind of in the same way that you would if you were looking to buy like a TV or a microwave or a can opener. And I really encourage you to go out here, just play around for 5 or 10 minutes in the provider search tool, just so you understand how to actually go about finding those specific in-network physicians. You understand how the funnel works, going broad to narrow. and making sure you can understand how the tool works, because it's going to save you some time in the long run. If you're going to a visit and your primary care physician says, hey, I want to refer you to a specialist, to a cardiologist, you can just pull your phone out, or you can get on your laptop, just quickly go through and shoot and run a search on those cardiologists that are in our network. I'll do another example here on our search tool for behavioral health. So let's say, behavioral health. We did a people search on the medical side. So let's go ahead and do a facility search on the mental health side. So mental health, it works the exact same way. We're going to give you the same kind of categories. We'll go into the places section. This is where we're, again, thinking of as a funnel, going from broad to narrow. So we do have an option to search for all facilities in our area, but if you're looking for a specific kind of facility, want to differentiate mental health between mental health substance use, you do have the ability to make that distinction here. But when you click on this, again, much like on the medical side, you're going to end up in this specific format. Your facilities are going to populate on the right. Filtering is going to be on the left. And all these facility names, I know this is a demo tool, but this is how it's going to display on your end. All the facilities are going to be hyperlinked, so you can click in to the facility and get some additional information on it. Overview, if they do have more than one location, again, physician directory, so all those physicians who do practice in this particular facility, it's going to be listed here. So, talked a lot about the provider directories, finding those in-network physicians, but I want to focus a little bit more on this cost estimate tool, because yes, we do have it built into our provider directory, but let's say you wanted to actually just go in and say, hey, I don't need to find a physician. I just know I have to have an MRI done, or I know what to have to have something done. You can actually just go and estimate any out-of-pocket cost for a procedure that you want through this tool here. Again, I definitely encourage you to all play around with this, just so you can kind of understand the process, maybe do a couple test results for yourself. For this example here, let's go ahead and use imaging for an example. Let's see, what kind of service do we want to estimate? Let's just use, let's do MRI. And let's go ahead and get an MRI scan of our jaw. So, well, not sure what is going on with this tool here. Let's just go all services. I do apologize for this demo here. Here we go. All right, so we're doing a cost estimator here. Let's go ahead and estimate this first cost here. And when you click on your services, this is typically the next question that you're going to prompt. It's going to ask you one of two things. Okay, it's going to ask you, okay, do you want UHC? Do you want our website to find the physicians for you? Or do you want to go in through our provider directory and choose the actual physician that's doing these services? By clicking on this link, it's going to drop you back into that same provider directory we looked at recently. We're going to go on, click the physicians, and run your estimates that way. But for this particular example, we'll just go ahead and use, we'll let the website find the physicians for us. So we're going to click on this. The website's going to think, it's going to gather all of our information. And again, it's going to spit us out an estimate. Again, format's going to look extremely similar regardless of what estimate you do. But you can see with this more complex procedure, we're going to give you the 30,000 foot overview up top here. And then below, we're going to actually break out the steps of the service. So like I mentioned earlier, you're going to have that specialist office visit up hand here. You're going to be estimated this is what the procedure is going to cost for you. Here's what you're paying out of pocket on that procedure. Step 2, this is the facility you're getting it done at, what the service is going to cost, what you're going to pay out of pocket, and your follow-up visit, etc. Now, I know these are posted as cost estimates, but one thing I really do want to hit home here is we're actually using the contracted rates that our in-network physicians have behind the scenes to generate these estimates. So while we do note these as estimates, we're using the contracted rates that these physicians have. So the estimates are pretty darn close to what you'll see in when you actually go and have those services done. I think I ran into one issue with a member who was doing I can't remember what the actual service was. It was something that had to do with like I think it was an imaging procedure. And we ended up running the actual visit, and I think it was going to be like $1,000 or something like that. And when the member got the actual total bill back, the cost was actually like $2,500. And we were like, well, that seems a little off, because we ran the estimate and the estimate was showing this. And it comes to find out that the estimate that was ran was the service being done on an adult as opposed to a child. And I guess with this particular service, the newborn had to be put under anesthesia. And when you actually factored in that anesthesia cost for the newborn, the estimate was within $15 of that particular cost. So just keep that in mind when you're running these. Not only are we basing these estimates based on the provider's contracted rates, but when we actually give you your estimated out-of-pocket cost breakdown, we are taking into consideration the specific medical plans that you are enrolled on. So, when you show, hey, X amount is going to be applied to my deductible, I'm going to have this much in coinsurance, this is what I'm paying in copays. All of that is based on your specific plan and your specific plan benefits. So your estimates for a service could look completely different than your coworkers who's on a different medical plan. So again, really tailored to you and your family's specific plan benefits.
Hey, Logan, this is Bridget. Can I jump in real quick?
Absolutely, yes.
So how you showed at the very beginning, that homepage when you logged in, it had, Chris demo or whatever his name was. But if there were family members, since you're talking about like a newborn and an adult, the difference in cost, that's where they would go first. And would they move to the correct family member before they looked up the service? And that would apply the right cost estimate. Is that correct?
So the cost estimates are going to be generated regardless of really the family member. If I'm following that, if I'm following that question, if you know that such and such is going to have a service done, we're going to run that estimate again based on the benefits behind the scenes. So it's not really going to factor in the actual participant that's going to be having the service done for it, if I'm following the question correctly.
Yeah, I was just thinking whenever you said the cost estimate that you guys did 2,500 versus the 1,000, but when you went back and you added that anesthesia in for that child, then you were only $15, off of what the estimate was. I was just wondering if you could put in the specific person or age group that you were talking or trying to get an estimate for, if that mattered.
Okay, yeah. So I'm following that, and yeah, that's not a feature that we have at this point. Again, that was just a really odd scenario that just kind of outline really how close a lot of these estimates are going to be, and really where I see this tool being really powerful for really everyone on the call here is for those office visits, your MRIs, any kind of scans, imaging procedures. Because believe it or not, I think I see the biggest distinction on really MRIs and then overall lab visits as well. You'd be surprised the actual cost variance that occurs depending on what you're actually having the services done. For MRIs, for example, if you get an MRI done in a hospital facility setting, that MRI is going to be done the exact same way if you go to a freestanding clinic. And when you look at the overall total costs of those services, an MRI in a freestanding facility can typically be, 5 to 10 times less than the same MRI with the same results done in a hospital setting. So for those of you who do have a imaging service or maybe some labs scheduled, I know typically my primary care physician does it as well. You will see them say, hey, I want you to go get these labs done. And just go ahead and walk down the hallway here in the hospital and we'll get you taken care of. You can pull your phone out, do some quick estimates and say, hey, I would rather, instead of getting my labs done in this facility setting, I'm looking online here and my labs are going to be much less expensive if I go to like a LabCorp or a Quest Diagnostics, or, maybe the MRI that I get done at this freestanding facility across the street would be a little bit less, and really open that conversation up with your primary care physician to see if you can get a prescription written for the labs, or a lab order written, or a lab order for the MRI. So you can really pick and choose where you're getting your services done at. And throughout the long run, throughout the entire plan year, you can see quite a bit of cost savings just by taking 5 to 10 minutes to come on here and use this search tool.
Thank you. And I think that's where our group is going to find their biggest discounts, you know, and how you were talking about MRIs or x-rays being such a differential in price. It's crazy. I've seen the same thing, an x-ray costing over $1,000, down the road, 150. So that cost tool is very important.
Absolutely. Yeah. So talking through the cost estimate tool on the medical side, that's going to be a really great tool. The next section of the website I want to look at is going to be around your prescriptions. So how do we go about searching our prescription drug list to see what prescriptions are quote unquote in our drug network, and how you can go out and price those out as well. So all things pharmacy through myuhc.com are going to be handled under this tab here, this pharmacy and prescriptions tab. And we've been moving a lot of our optimorex branded things to myuhc.com. So we're going to give you the ability to do a couple things without having to link over to our optimorex website. The first thing you're going to be able to do is find and price medications. So that's essentially doing the exact same thing as the provider search tool. We can click through this tile here, and it's going to ask you to search a specific medication. If you know it by name, you can type it up here. If you have a listing of medications that you have already loaded in your medicine cabinet, so to speak, you can sort those out here. One thing I will say about the medication search, I know medications have really crazy names. So usually when you're searching your medications right here, if you get the first couple characters right, it will auto-populate similar to how like a Google does when you do searches, just so you can click the rest of the medication out here. I know that it's typically an issue, but when you go through and search your medication, this is how it's going to display on our find and price medications page. Now notice again, the format here is extremely similar to how the provider search tool. On the right-hand side here is going to be all the different facilities that you can fill this medication at near your area. And then we're going to have some different filter options over here to update the search for the brand or generic, you know, if it's in a different form, strength of the medication, quantity today supplied, etc. Now, from this page, I'm going to point you to probably the most important areas of the website. The first one is going to be in the top right-hand corner here. You're going to see a little green check mark for those prescriptions that are covered under the plan, and you're going to see a red X for those that are not. The red X's are obviously not covered. Green check marks are. If a medication is covered, below here, we are going to list you pharmacies that are in our network. And again, it's going to be tailored to your zip code where you can fill these in a retail setting. And we're going to show you, again, for your specific day supplied, what you would pay in that retail setting. Now, if the medication you're searching is a maintenance medication and is eligible for OptimoreX's home delivery, where you get essentially a 4-month supply delivered directly to your door, we are going to show you that medication is eligible for home delivery, and also show you what you would pay if you were to switch that medication to a home delivery fill. Not only are we going to show you the price if you do switch it, but we're also going to give you a link to go and manage your home delivery and get that prescription switched over. Again, if you don't want to go through our website, feel free to give the number on the back of your ID card a call. They can link you over to our OptimoreX team. Just let them know you want to switch to OptimoreX mail order, and they can connect with your primary care physician to get a new prescription written to fill that. So again, why is this important? Because like with those different like MRIs and labs and whatnot, brand versus generic pricing on medications is insane. I mean, you can have a brand medication that might be covered at, let's say, like a tier 2 or a tier 3 on a prescription drug list that might cost, $1,000 a month for a fill, when you could have a generic medication that has the exact same active ingredients in a tier 1 space for like maybe $10, $15, $20, $30 for the exact same active ingredients. So really take this into consideration. If you're already filling medications under the plan, definitely come out here and see what you're paying for those already. Odds are you probably have a good idea what you're paying, but just come out here and take a peek and see if there's any other medications that could be a generic equivalent, to see if we can save you some money throughout the long run. by switching to those generic equivalents. Now, one thing I will note, if you do have a medication that is not covered under the plan, don't worry, you will see a red X up here, but we're not just going to tell you, hey, that medication is not covered, try your search again. We will list out for you below the non-covered medication. We will list out for you the covered alternatives under the plan. Both those alternatives that are listed will be hyperlinked. And just by clicking on that alternative, it will actually bring you to a results page, much like this, that's going to show you the covered alternative under the plan and the pricing for that. So again, a really great tool that we have. If it is not covered, don't worry, we will list the covered alternatives out here that you can search your prescription drug list for. Now, I know we talk a lot about whether or not the medication is covered or not covered and what the medication's cost is, but I would probably say the two most underutilized sections of this website are these two links here. One is the proper use and the second is the possible side effects. The proper use is just going to give you a lot of information about the drug, what it's used for, things that you need to know when you're taking the drug, what to talk to your doctor about, how to take the drug, things like that. And then possible side effects, pretty straightforward. What are some side effects to experience, serious side effects? And I really like this information because if you are looking for a primary care physician, let's say you haven't had a primary care physician and you're looking to settle on a specific person, or let's say you're on vacation and your primary care physician has prescribed you something, but maybe you're having a visit with a doctor out of state and you have some questions for him. This can be a really great resource just to open up dialogue with those specific providers. I know my girlfriend, she's actually a provider in urgent care, and she really encourages members to do some research ahead of time, just to kind of understand what they're getting into. It really kind of shows her that members are kind of taking an interest in their health and they really want to understand not only their health and what they're taking, but she likes the interaction and getting to know the patient and be able to know that patient's specific history with any kind of medications they may have. And that really goes for medications or any other kind of labs or imaging things that have been done, any kind of health history items. So definitely keep that in mind. Okay, so that was the find and price of medication. We also do give you a pharmacy locator. Again, that works essentially just like our provider search tool. Based on the zip code we have for you, we're going to show you all the retail pharmacies nearby. For the most part, you can get medications filled at pretty much any pharmacy. Everybody's got like a Walmart or a CVS or a Walgreens nearby, so you should never have any difficulties finding pharmacies. And then your managed prescriptions tab, this is actually the section that you are going to go and link out to our optimorex dedicated website. So if you need to do something other than looking up a medication, pricing a medication, finding a pharmacy, let's say you have a medication that's through mail order and you want to go and check the status of that fill, the manage your prescriptions tile is the way you're going to do that. And this is the section that you're going to get landed into here. And this is just essentially going to be all things pharmacy for you. So we're going to give you your medicine cabinet. If you have any medications that are currently going through home delivery, we're going to show you the listing here. If they are due for a refill, you can trigger the refill here. If they've been refilled and you're currently waiting on them to ship, or maybe you're waiting on the updated prescription from the provider's office, you can see order status through those or through here. And you can also see the number of refills remaining through this website. If you do have any questions on our specialty pharmacy, let's say you're taking a medication that does qualify as a specialty medication, we will show that on our PDL search tool, but you can get additional information about our Optum Specialty Pharmacy here with some contact numbers on who to contact to get your medications switched over to Optum Specialty Pharmacy. Begin filling that way. Our information center, if you ever did need to do any kind of manual claims for your prescriptions, you can get some claims forms through this segment here. And then if you ever needed to contact OptimRx for any kind of issues that you may run up run up against, or let's say your internet's not working, or not your internet's not, but your provider's or your PDL search tool is not working, or you have questions on a specific medication. Maybe you're not seeing a script come through, you're not seeing a claim come through. You can get the OptimoRx's contact information here to reach out to them. So again, this is for your more in-depth pharmacy items. I would venture to say that for the bulk of you, I would say probably 80 to 85% of what you're going to be doing is going to be through the prescription drug lookup tool and the prescription drug cost tool that we referenced earlier through the myuhc.com website.
Logan, I have one more question, please, sir.
Yes.
Does each person in the family have to have their own health safe ID and separate login, or can we just see the family at a glance?
So the question was, will each individual have their own health safe ID? And in short, yes, they will. Now, I will preface that by saying whoever is enrolled as the employee on the plan, you are essentially going to have super user access for the family. So you're going to get to see yourself and everybody else under your family. If the spouse wanted to create their own account, or if the dependent children above, I think it's like 13 or 14, wanted to create their account, they will have their own health safe ID logins just due to privacy, HIPAA privacy, but they will only be seeing their specific account. So I know I've seen issues or situations where like an employee and spouse both work at the same company. So whoever's noted as the employee is going to have that super user access.
Okay, thank you.
Absolutely. So we're moving right along here. We've found our providers. We've searched for medical costs and services. We've searched our prescription drug list. We've priced our prescriptions. At some point, as you're having all these services done, you're going to start seeing claims roll through. And I'm sure you probably had a good idea on where you could go for that. Claims and accounts tab. So like I mentioned earlier, we want to get your questions resolved in as few clicks as possible. So when we were designing the website, we thought to ourselves, okay, if somebody's coming into our claims and accounts tab, chances are they're probably going to be looking at a claim that's recently came through. So when you actually click on the claims and accounts tab, we're going to give you a listing of all those recent claims that may need your attention, claims that have came through like in the last couple of days or so, or maybe claims that are still showing pending or in process. We're going to list them out here. But for the full listing of claims, you're going to come to the subcategory titled, you guessed it, claims, and we're going to give you an entire claims breakdown. Again, keep in mind the formats. All your claims are on the right. Filter results are on the left. If you have any questions on claims, how much is provider X billing me? This is where you're going to find it here. And we break the claims out a number of different ways because everybody likes their claims broken out a different way. I've been doing this job for about 5 years now. Everybody likes to see things a little bit differently. So we give the claims breakdowns a couple different ways. From the search here, we're going to give you a high-level overview on what was billed, what was discounted under the plan, what the plan paid, what you have paid at the service, or what you may owe. If you wanted to see a more thorough breakdown, each individual claim is going to have a hyperlinked claim number. You can click into that, and we're just going to further break out that specific claim for you. So again, a lot of the same information, dates of service, dates received, total amount billed. This is more of a adding and subtracting format. So total billed, what was discounted off of that from the plan. Maybe you paid a copayment in person and what you may owe under the plan. If anything kind of coupons are applied, like for a prescription drug, if you had a manufacturer's coupon apply, we're going to show that here. And all the way at the bottom, we're going to break it out again, a different way for you, just showing you, again, multiple different ways how to view the claims. Now, these are essentially online explanation of benefits, but if you ever wanted to print like a PDF copy of every explanation of benefits that you have, you can print out these through this little button here, this View Explanation of Benefits tab. This will essentially give you a PDF copy of the EOB. So if you ever had to, let's say a provider is charging you, some X amount for a visit. And you can basically go to the provider and say, hey, no, you shouldn't be charging me for that because my plan covered X. You can print out a copy of your EOB and send it to your provider to show them what has paid underneath the plan. That's typically what I see this button being used for. If you ever had to make a note on a claim, like, check back on this note or ask a question about this note or about this claim, you can make a note here. And if you do have questions, like, okay, looking here, it's like, okay, I can see I had $42 billed. Okay, $12 is discounted. So, okay, that'd be, 40, 32, $30. Okay, I paid $30 in person. So why does it show that I may owe $30 here? If you ever had a question, a couple different ways you can get that taken care of. We do give you links where you can ask a question on these direct claims. These questions are essentially routed through secure messaging behind the scenes to one of our advocates. Or if you prefer to actually talk to somebody and talk through the claim, you can call the number on the back of your ID card, and they'll be able to break down the claim, how it's processed. Now, our advocates are really knowledgeable in claims processing. That being said, if you do get an answer from them and you're either not sure what kind of jargon they're using, maybe they're using some things that doesn't make sense, or even their breakdown of the claim doesn't really make sense, at that point in time, feel free to reach out to your HR team, and they can work, with myself, some of our other account management team that's dedicated to your group to get your questions answered and get you some additional clarification on how these particular claims process. But I definitely encourage all of you to either use the number on the back of your ID card or the ask a question link here, because they're going to be able to get, I would probably say 90 to 95% of the issues that you've had resolved. Every once in a while, there's a complex issue that may need some additional support, but it's definitely a really great first line of defense for you. Now, these are the individual claims. If you ever wanted to see, okay, I can see that I've paid $30 on this claim here, but okay, that tells me for this claim, where am I at in my deductible and my out of pocket throughout the year? Well, we give you a plan balances tab, and that's where you're going to go to see your deductible and out of pocket throughout the year. So if you had a question on, hey, I'm showing my employee, I've met X amount of my deductible, my spouse has met X amount of his deductible, out of pocket maximum, any children who have their own separate deductibles, you can see everything broken out here. So a really great way, again, at a high level, to do your deductible breakdowns for your plans. So if you ever see a claim and you see a claim come through and it's like, oh, it's showing as $150 and it's showing my plan paid $150. I didn't think I was going to have to owe money on that. I thought I was going to have to owe money towards my deductible or owe money towards my out of pocket. You can come to your plan balances section here and get a nice look to see where you're at. Again, keep in mind, for those of you that are on high deductible plans, deductible is typically going to be that member responsibility, 100% member responsibility, until you start kicking into that co-insurance phase and start sharing costs with the plan. And then the out-of-pocket maximum, again, once you've met that out-of-pocket maximum, you're going to be done paying for the year. Again, I will note that the in-networks are shown here. So again, if you've met your in-network out-of-pocket maximum, as long as you're using those in-network physicians, you're going to be essentially done paying for the rest of the year on your medical. So plan balances. I get a lot of questions, and we've seen a couple questions. Hey, went to a out-of-network physician and they didn't submit a claim to UHC. How can I get that ran through my insurance? Or, went to an in-network physician, he doesn't use any kind of electronics, he's still submitting claims and he's not submitted one to UHC. You do have the ability to go and submit claims on your own. Again, I typically see it coming into play with out-of-network providers who don't want to submit claims to UHC. So if you work with that out-of-network physician and get the necessary information, you can come to the Submit a Claims tab under your Claims and Accounts tab and go through that manual submission process. It's going to ask you and essentially walk you through step-by-step all the information you need. Can't link over into it in this demo, but it's going to be an online form you fill out, submit it through UHC, and we'll get that process behind the scenes. Again, that being said, 99.9% of providers have some kind of EMR system behind the scenes that's going to get those submitted for you. So you're very, very rarely going to have to come here and actually submit manual medical claims, manual mental health claims through the system. But it's always good to know that it is out there. Now, the last section that I want to go through here that I think is probably one of the most important, it's like who here on this call has probably had a question earlier about, okay, I wonder if I have coverage. I wonder if I have benefits for X. I wonder if I have coverage for Y. You know, what are my benefits for X? Well, we give you a coverage and benefits tab right up here. And this is essentially going to be like having an electronic benefit summary for all things tied to your plan. So if you ever want to go out and see, okay, what are my copays for prescription drugs? You know, what do I pay for a physician's office visit? What am I going to pay for, you know, inpatient surgery? The coverage and benefits tab is where you're going to come here. We're going to give you a couple different ways you can filter. You can filter by medical, prescription drugs, specific plan overviews. And then on the right-hand side here, we're just going to give it to you. And again, another format based on common services. So for this demo here, preventative care, you know, preventative care is always covered as long as you're using in-network. So we're going to show you that here. For emergency care, let's see, this member's plan, urgent care is going to be 20% coinsurance after the deductible is met. And again, when you visit a network provider. So really a great way to go review your benefits, again, before you have the services done. It's just like having a benefit summary. It's basically just like having Bridget standing right next to you. You can basically say, hey, Bridget, what am I paying for an office care or a primary care physician visit? She'll say, hey, 20% coinsurance after you make your deductible. Or if you're on a copay plan, it's going to be, hey, you're just going to pay this copayment, plan will take care of the rest. So definitely go out here and utilize this. And this can be another tool that you're using when you're auditing your actual claims. Let's say you had a claim come through and you're like, okay, I went to my primary care physician. I'm getting charged like, you know, $97. That's weird. I thought I had a copayment tied to my primary care physician visit. Well, you can come out to your coverage and benefits tab here, scroll down to office visits. And you can say, okay, primary care physician visit. Yep, it is 20% coinsurance after the deductible. Had met the deductible, so that makes sense. Or you could say, oh, that's odd. It says I should be paying a copay here. And then seeing that discrepancy, you can reach out to the number on the back of your ID card, or through our secure messaging through the system here, ask a question on that particular claim to see what the processing error may be. Pretty straightforward, but really useful part of the website here. All right, with the last 5 or so minutes, I want to go through this very last tab over here. This tab is called our Health Resources tab, and I really think of Health Resources as essentially the everything else that UHC has to offer you and your covered family members under the plan. We spend a lot of time talking through like primary care physician visits, prescription drugs, medical claims. We often kind of lose sight of the fact that you have so many different embedded health and wellness programs, care management, disease management programs that's no cost to you through your benefits. The Health Resources tab is where you're going to come and find that out. Just off the top of my head, we have some built-in health and wellness tools called Rally. Rally is kind of like UHC's digital health and wellness platform. We have care management and disease management programs, things like our cancer resource services. If you ever had any questions about any kind of mental health or behavioral health benefits outside of what you would typically see, like office visit, inpatient, outpatient visits, questions on specific care management programs, all can be found through this specific tab here. Again, I could spend probably a whole hour going through all the different resources that you're going to have access to. But one thing I would definitely leave you with is that if you ever have questions, again, I say this a lot, just call the number on the back of your ID card, and one of our benefit advocates or our nurse advocates will be able to help guide you into the correct program or service that you that may apply to you. You can simply call them up and be like, hey, you know, family member of mine is just recently diagnosed with cancer, for instance, do you have like a care management program for that? And our advocates can go through all of your benefits that you have and say, oh yeah, you have this, this care management program. Let me see if I can get you connected with a nurse who can kind of act as that point contact and kind of walk you through the healthcare system. So again, a lot of different health resources out here. My simple ask would be, if you ever have a question about what's included in your plan, call the number on the back of your ID card and they can walk you through that. Again, we have so much stuff out here besides, we do so much for our members besides just paying claims. Again, if you do have any questions, again, number on the back of your ID card is where to start, or definitely reach out to your HR team and they can get you some additional information on some programs that might apply to you. So I do want to be cognizant of everybody's time. We are right at 7 o'clock, it looks like. So again, I will at this point in time, open the floor up for questions. Any questions from people on the phone? If you have questions about the website, want to see some other areas, questions that you come up against, I'd be happy to field those at that time. Just want you to know you are probably on mute right now. So if you do have a question, feel free to unmute yourself and ask away. Okay, just going through the chat here. See the health safe ID, nothing's coming through the chat. Again, if you do have a question and you don't want to verbalize it, again, feel free to throw that through the chat and we'll field those as well.
Thank you for your time today, Logan. I appreciate it.
Yeah, and again, I do appreciate everybody taking the time out of their evenings to hop on and kind of learn a little bit more about the website. Again, for those of you that have already registered on the website, again, hats off to you. This is probably nothing new to you, but definitely hope that throughout this hour, kind of clicking through some of the different areas and segments, I definitely hope you've taken a couple things new home about, searching for a provider, or maybe not knowing that the provider's cost estimate was built into the provider search, not knowing you could search for covered alternatives to the prescription drug list, or not even knowing how to access your claims and accounts tab. Again, one thing I will say, and I will say it until I'm blue in the face, if you have a question, the worst thing you can do is not ask. Believe it or not, I guess is the last kind of story I'll leave y'all with, but I had a group. It was my very first group that I ever had working through this job. And I went out, did an open enrollment meeting, talked about all the cool things that UHC has, all the cool program services, the website, things like that. Left to go home from open enrollment. And then I came back 1 year later, and I had a gentleman pull me aside and say, hey, Logan, I appreciate you coming out here, but I've been having an issue with one of my medications. I'm like, okay, what seems to be the problem? And he's like, well, I haven't been able to get medication filled. It's like, okay, well, how long have you not been able to fill your medication for? He was like, I haven't been able to get filled all year. And come to find out, the reason he wasn't able to get his medication filled is because his physician needed to get a prior auth submitted. He had met all the guidance, all the guidelines for it. All we needed is a prior authorization from the actual provider. And he never reached out to his HR team, never called into UHC customer service, never used our online messaging to reach out to one of our advocates. He just kind of saw that and then didn't deal with it. And then waited a whole year to come out and finally reach out to somebody. And we were actually able to get his issue resolved at the meeting just by calling the number on the back of his ID card. One of our advocates was able to three-way call in him, our advocate, and the provider to get a PA submitted. They submitted electronically through our system, and we got that filled, taken care of in the meeting. So you have a very broad support system working behind the scenes to make sure your experience with UHC is tippy top. Our advocates, your HR team, and then we also have a dedicated team behind the scenes working with your HR folks. So that's kind of the one thing I will leave you with. If you ever do have questions, again, never hesitate to ask because we're here to serve you.
All right, I'm going to go ahead and stop the recording just in case there's others who want to ask questions offline. So thank you again, Logan, and we appreciate your time. Thanks for being so thorough.
Thank you very much.